Fasciitis is a general medical term used to describe inflammation of the fascia, the connective tissue that surrounds muscles, blood vessels, and nerves throughout the body. This condition can range from mild and localized to severe and life-threatening. The type of fasciitis, its causes, symptoms, and treatment options can vary widely, depending on the underlying condition. What is fascia? The fascia is a band or sheet of connective tissue, primarily collagen, that lies beneath the skin and attaches, stabilizes, encloses, and separates muscles and other internal organs. It plays a crucial role in supporting body structures and transmitting mechanical forces. When this tissue becomes inflamed, the result is fasciitis. There are several different types of fasciitis, each with its unique causes, symptoms, and treatments. Common types of fasciitis. 1. Plantar fasciitis. Plantar fasciitis is the most common form of fasciitis. It involves inflammation of the plantar fascia, a thick band of tissue that runs across the bottom of the foot and connects the heel bone to the toes. Causes: overuse, flat feet, obesity, improper footwear, or excessive standing. Symptoms: sharp heel pain, especially in the morning or after long periods of rest. Pain typically improves with movement but can worsen after prolonged activity. Treatment: rest, ice, anti-inflammatory medications, orthotic insoles, physical therapy, and in severe cases, corticosteroid injections or surgery. 2. Necrotizing fasciitis. Necrotizing fasciitis is a rare but life-threatening bacterial infection that spreads rapidly through the fascia. It is often referred to as a flesh-eating disease. Causes: usually caused by group A Streptococcus, Strep A, bacteria, but can also involve other bacteria. It often enters the body through a cut, burn, or surgical wound. Symptoms: severe pain, swelling, redness, fever, fatigue, and skin discoloration. The infection progresses quickly, leading to tissue death, necrosis. Treatment: emergency surgical removal of dead tissue, intravenous antibiotics, and intensive care. The prognosis depends on how early it is diagnosed and treated. 3. Eosinophilic fasciitis, Schulman syndrome. This is a rare autoimmune condition that causes the fascia to become inflamed and thickened, typically in the arms and legs. Causes: the exact cause is unknown, but it may be linked to autoimmune dysfunction or triggered by strenuous exercise or trauma. Symptoms: skin swelling, thickening, and hardening, especially on the limbs. It may also cause muscle weakness and pain. Treatment: corticosteroids and immunosuppressive medications like methotrexate are commonly used. Physical therapy may help maintain mobility. Other forms of fasciitis. Myofascial pain syndrome, chronic pain disorder caused by inflammation and tightness in the fascia and muscle tissue, often with trigger points. Diffuse fasciitis with eosinophilia, a systemic variant of eosinophilic fasciitis with elevated eosinophils and systemic symptoms. Paraneoplastic fasciitis, associated with certain cancers, inflammation may be part of the immune system's response to a tumor. Symptoms of fasciitis: generalized. While specific symptoms vary depending on the type, common signs of fasciitis include localized or widespread pain, redness and warmth over the affected area, swelling and stiffness, skin thickening, especially in autoimmune types, fever, in infectious fasciitis, fatigue and malaise, in systemic types. Diagnosis. Diagnosis typically involves a combination of medical history and physical examination, to assess symptoms and risk factors. Imaging tests, MRI, ultrasound, or CT scans may show inflammation or damage. Blood tests, look for signs of infection, elevated white blood cells, or autoimmune markers. Biopsy, in some cases, a tissue biopsy is needed to confirm eosinophilic or necrotizing fasciitis. Treatment options. Treatment depends on the type and severity of fasciitis. For plantar fasciitis, conservative methods like rest, stretching, physical therapy, orthotics, and NSAIDs. For necrotizing fasciitis, aggressive surgical debridement, broad-spectrum antibiotics, and intensive supportive care. For eosinophilic fasciitis, corticosteroids and immunosuppressants. For chronic pain syndromes, trigger point therapy, myofascial release, acupuncture, and psychological support. Prognosis. The outcome varies. Plantar fasciitis has an excellent prognosis with proper care. Necrotizing fasciitis can be fatal without prompt treatment, mortality rates range from 20% to 40%. Eosinophilic fasciitis may go into remission with treatment, though some people may experience relapses. Prevention. While not all forms of fasciitis can be prevented, general measures include maintaining a healthy weight, wearing supportive footwear, promptly treating wounds and infections, avoiding excessive strain or trauma to muscles, regular exercise and stretching. Conclusion. Fasciitis encompasses a range of conditions, from mild inflammatory issues like plantar fasciitis to severe and life-threatening infections like necrotizing fasciitis. Early recognition and appropriate treatment are essential to prevent complications and ensure recovery. If persistent pain, swelling, or systemic symptoms occur, it is crucial to seek medical attention for accurate diagnosis and intervention.